that smaller group feel, this is how to plug into that. There might be more regions starting next year that open it up, but even if you don't live in that region, I'm sure there's some people that are coming even from outside of Pennsylvania. So please take advantage of that. Delaware County, Montgo, Lehigh Valley, and York. So with that, I am very pleased to introduce our next speaker. Dr. Shannon Smith is a friend of PA Lyme. He is really a fixture in the Harrisburg, Pennsylvania area. He works out of the Turnpaw Health and Wellness Center, and we have come to appreciate Dr. Smith's breadth of knowledge as it really relates to Lyme and chronic Lyme, not the easiest stuff. Why am I not getting better? So Dr. Smith is a graduate of Palmer College of Chiropractic. He is also board certified in clinical nutrition, which lends itself perfectly for what he specializes in. So he's been in private practice for 23 years in the Pittsburgh area. He splits his time. He has some appointments in the Pittsburgh area, and a lot of the appointments are in the Harrisburg, Pennsylvania area. So he also functioned or specializes in functional medicine and autoimmune support. One of the really accolades for Dr. Smith is he's one of only a few doctors of chiropractic to be invited for certification from MedMaps. If you're not familiar with them, it's the Medical Academy of Pediatric Special Needs. This is a group that specializes on the autism spectrum in terms of evaluation and support. One of the things we look up to with Dr. Smith is he's always plugged in and current. He attends more conferences than I do. He has to keep his medical certification, but he has over 660 postgraduate hours of nutritional training, Lyme training. He's a member of ILADS, and he really lectures at many conferences around the state, around the country on functional medicine and that particular approach to treatment along with clinical nutrition. So as I said, he is a good friend of PA Lyme. When we talk to the individuals that show up to our monthly Harrisburg regions and we do evaluations, almost always Dr. Smith's presentation scores the highest in terms of understanding, in terms of knowledge that's applicable, and something that's very actionable. He works pretty hard to make sure that when you walk away from his presentation, you have a couple of nuggets that you can jump right into and make actionable. So with that, allow me to turn that over to you, Dr. Smith.
Okay. Well, that was wonderful. Thank you very much for the kind words. It's now over, I think, 720 seminar hours. I'll have to update that, but not to toot my own horn, but I try my best to keep very, very current. Lyme and chronic Lyme, both acute and chronic, are very, very ongoing and fluid, I guess. There's stuff that's changing all the time. So I guess that's a pretty good segue into what we want to talk about tonight. And in coming up with this, this topic, and certainly it's a topic that is very problematic because, it's easy to say I have, I shouldn't say easy. It's easier to say that I have Lyme, I was treated and I'm fine. And we certainly have those patients and we certainly see those people and God bless them, but it's the ongoing, I was diagnosed, treated, but I'm still a symptomatic patient that we see quite frequently in our office. And so, the challenge becomes, what do we do next? And, we have a lot of different patients that come in and in different situations that have been treated or they've tried this, they've tried that, they've been on antibiotics, they've been on different antibiotics, and hopefully they get off that roller coaster at some point because it worked and they feel better and they get their life back. And, the challenge that I have with patients and that I try to get across is that, Lyme isn't just an illness. Unfortunately, it doesn't fully go away. So it has to be looked at as health of host and you have to look at the patient that has the disease. And so unfortunately with Lyme disease, there's three things that it causes. And it causes an immune suppression, and we call it a Th1 suppression. So for those of you that aren't familiar, I'll get into that a little bit.
Hey, Dr. Smith. Dr. Smith, sorry for interrupting. Can
Yeah.
you turn your slide to slideshow view? We're seeing two slides at
Oh, my
once.
fault. You know why? I still have my other screen plugged in. I think that might be why.
Sorry for interrupting.
There we go. Is that better?
Awesome. Thanks.
My fault. Okay, so, there's three things that it causes an immune suppression. Lyme doesn't necessarily want to not dominate. It wants to dominate the individual. So it causes us to have a Th1 suppression. This side of the immune system deals with infection. So, it doesn't want you to fight the infection. So we'll talk a little bit about that. Today, we're going to really talk more about mitochondrial dysfunction and energy production, energy depletion, and try to go through, talk simply about mitochondria and kind of what it is if none of you, or if some of you don't understand what the mitochondria is, and then get into a little bit more deeper. I'm going to challenge you a little bit. And then towards the end, what you can do on at home, supplements, and certainly the stuff that we have in the clinic that we can help with. So, and then the last thing is oxidative stress. I always tell patients, I don't feel good. I'm aging more rapidly. I feel 20 years older. I can't get out of bed. I just don't feel like doing things. That's an easy way to say oxidative stress. This is an aging process in the body. Of course, we don't want that. So, these acute and then often chronic states continue cellular immune responses to fight the unresolved infection. Or it's due to an inability of the body to resolve an alarm phase that happens. We call it the cell danger response, and we're going to get into that. But easily that's being said is that when people get into these chronic stages, how do we get out of there, and why is the body staying in there? And if it's because of an infection and I killed it, I went on antibiotics, why does it not resolve and kind of reset? And again, that's the challenge. We're from post-treatment Lyme disease syndrome or post-treatment syndrome. The inability of the body to resolve that alarm phase is an ongoing dilemma, and it's individualized with patients. And that's what we're going to talk a little bit more about today. So this immune dysregulation and or the immune suppression over time, it then leads itself, unfortunately, as a negative feedback to cause further mitochondrial dysfunction. And then it leads to further things of oxidative stress. So for those of you that don't know what a mitochondria looks like, here's a cell. We have a gazillion of them in our bodies, and there's the little mitochondria. And this is kind of what it looks like blown up. And then there's DNA inside the mitochondria, which we'll talk a little bit about today too. So this is what it looks like. And it's kind of an energy, the pretty much the basis of energy factory of the body. As you know, it's responsible for producing 90% of our energy. Low numbers of mitochondria or the low function of the mitochondria basically equals low energy. This explains why mitochondrial dysfunction is the primary cause of age-related decline. In fact, many age-related diseases such as Alzheimer's, cancer, and other heart failure are linked to low mitochondria and or dysfunction. High numbers of functioning mitochondria are a strong indicator of vitality and health. So it's really important for us to have healthy, non-aged, non-sick or dysfunctional mitochondria. The mitochondrial damage, if it is damaged because of Lyme or because of some other kind of a stress to the system, it can leak its DNA into the bloodstream, and then that causes an increased cell danger response. It's kind of like when that goes into the system, it's very kind of toxic for the body, and the immune system really starts to kind of get into an emergency situation, and then these alarms start going off. So back to simple things with what the mitochondria does, and so how you can make energy. So the simple fact of it is, if it's working well and you eat food and it breaks down and through the mitochondria itself, it makes energy. We call it ATP. So, certainly I'm going to eat certain types of foods, ketogenic diet, high protein diet, carbohydrate, and then certainly sugars, and then it should create energy for me. So the challenge is certainly, if I'm eating something that's causing this to not work right, then we dig into that and try to see how we can kind of change a patient's diet based upon the ability or inability to make energy from what you're eating. A little bit of a tangent that goes back to, we look for leaky gut permeability, gut absorption, digestion, And that has a lot to do with how you absorb your food, if your immune system reacts to it, and then how it's presented into the system. So we're not going to talk a lot about that today, but we do look at all those things. So mitochondrial dysfunction, it's in the background of a lot of chronic diseases, Alzheimer's, Parkinson's, fibromyalgia, autoimmune diseases, medication, here's Lyme disease, and then other things, chronic fatigue being certainly one of them. So is it the reason for all of this? It's definitely in the background of all of these conditions. Is it something that we should look at on all these? Absolutely. Is it the only thing that we need to do? Not, obviously not. But in Lyme disease specifically, in chronic Lyme, it's one very, very strong aspect of that chronic response. I don't have any energy. Why can't I make energy? And I feel tired all the time. So when you look at cell danger response or cell danger signaling, Dr. Navio has presented this for a while now. And, you know, I have to give credit where credit is due. So he talks about environmental triggers ringing this bell, or that's the same bell that's rung that tells the alarm to go off and or the body to start to create an immune response. You know, when we see these kinds of immune responses going on, whether it's an infection or it's a different type of a toxin, it's physical trauma. I see this with post-traumatic stress disorders where this alarm kind of turns on from a psychological component, and then heavy metals and chemicals. So the unfortunate state is that when people get infected with Lyme, they're not perfectly healthy, and other things could lead to an amplification of their symptoms. So what I tell patients a lot is that nobody's perfectly healthy when they get bit by these ticks. Your past health experiences matter, your past health matters, your present health matters, and your genes matter too. The other thing that matters is how long until you got diagnosed, how much infection did you get, what different types of infections, and all those questions need to be asked and or answered to help move forward with individualized care. Certainly it's challenging when we start seeing genetic onsets of inflammatory cascades and things like that. So sometimes it's just the fact of how your body was made as to how it's reacting to that chronic environmental stressor, and the alarm is turning on. Lyme turned it on, but other things can kind of leave it on, I guess is the easier way to say that. So when different stressors ring that same bell and elicits the danger response, that causes disease. What he also states is that the cell danger response persists abnormally wholly because of metabolism in the gut microbiomes are disturbed and collective performance of multiple organ systems is impaired, behaviors change, and then chronic disease. Things don't work right, the alarms stay on, your body stays stuck in a fight and flight response. It has a hard time with rest and repair. So we see people just wasting energy fighting Lyme, not only because it's still there, but also because the immune system is stuck in this response and it just constantly keeps an alarm going on. Turning that off, we're going to talk about some really easy things that you can do at home and or that we have in the clinic that's been pretty successful and helpful for a lot of our patients. Okay, so I hope that makes sense as to where we're going with this. I put this in here. You can certainly read it on on your own if you have this available to you on an ongoing basis. I know they're going to be put it up on their website, but simply acute versus chronic. I have acute injury or acute Lyme or chronic Lyme. During the acute injury, mitochondria reduce their activity, almost goes into hibernation, and it lets one part of the body, it's called glycolysis, or the mitochondria, take over as an emergency energy supply. The challenging thing with that is it's not a great way to make efficient amount of energy. When the danger is gone, the cells need to start healing, and that gets out of this hibernation, and it's supposed to go back into normal ATP production, but unfortunately, sometimes this doesn't kick back in. So this is when I say we need to hit that control, delete, and get back to normal. Unfortunately, there's a lot of different factors, some of which we're not quite understanding yet. We're working on it, but a lot of these different things is what's been able to help control, delete your brain to say, I'm not into that alarm phase. The Lyme isn't that bad. It's not overwhelming me anymore. Why are you still staying in a fight-flight response? So when we get stuck into glycolysis, I'll show you on the next slide that it becomes, well, here, I'll jump over. it becomes challenging. So glycolysis is kind of outside the mitochondria. So it makes 2 ATP, which is the factors of energy. Inside the mitochondria, it makes a whole heck of a lot more. So when we stay stuck in that fight flight response, there's not an efficient energy transport, and we get into this quick burning energy, which is a little bit easier for the body, but not in a long-term basis. So that's one of the things we're looking at, is how do we get back to that normal mitochondrial response? So I guess this is one of those slides that I show patients all the time, and I'm trying to keep it simple and hopefully a little bit easier to kind of explain. So I always say God gives you one size stress bucket. That bucket sits on a seesaw. If you picture this on a seesaw, that's your immune system. But we'll get to that in the next slide. So your stress bucket can't overload. When it overloads, it turns on all these different alarm signals. When you have these alarm signals, it'll start driving pain, or what we call cytokine escalation, poor circulation. There's some genetics that go along with that, so we check those markers. Inflammatory responses. Inflammation is pretty much the end result of all chronic illness or chronic immune responses. So when you have this inflammation signaling, whether it's in the brain or the gut or in tissues or your joints or whatever, it starts to cause more of an immune response. This immune dysregulation we talked about, in that second slide, mitochondrial dysfunction, and the low energy production. So this chronic overload turns on all of this. Certainly, we don't want any of that. So how do we deal with that? Well, one of the things I talk about is let's quit getting quit putting more rocks in your bucket. Let's get the water out. Let's get the overload out. So what are the stressors? Well, with patients that have Lyme, it's not that you created or had a gluten problem, a dairy problem, or a food problem. The challenge is when the immune system is challenged with this overload, it becomes more hyperallergenic over time. So what we find is that even though gluten might not have been your problem to start this, but it triggers an ongoing response. So we have to strongly reduce these things for patients to allow them to stop the overload. Now, if Lyme is the overload, as let's say it's a big rock in the bucket, it's easier for me to say, hey, you know what, clean up your diet a little bit, because that'll make a bigger difference until we can really calm down the system. So that's the one technique that we've used with that. Infections certainly are a big part of that. Physical stressors, chemical stressors. If people don't sleep, that's a big stress. We see a lot of that post-Lyme. And then unfortunately, people tend to try and cope with their stress with things that add stress to your body, including alcohol, sugar, tobacco, drugs. And then certainly just general anxiety disorders can actually drive that. So what we try to encourage people is to reduce this. Things you can do at home, prayer, love, laughter, hanging out with your family. Chiropractic is really good technique for calming down the system. Massage, yoga, meditation, acupuncture, exercise, immune support. So when there's an overload, the alarm goes on. So the cell danger response can be initiated with a Lyme issue, but other things can lead to keeping it on. This slide, if you look at the antigen being, let me go back, these are all antigens. So any type of a stressor is an antigenic response. So it can be, chemicals and over straining with physical stressors, but those antigenic responses, this is your stress bucket down to here, if you look at it that way. And here's the seesaw of your immune system. So Lyme will love to suppress Th1. That's your attack system. And then if this is a seesaw, all of these go back up. So this is allergy, and this is autoimmunity and asthma and other inflammatory responses. So when you have a shift, picture this being tilted, and then you have less capacity. If your bucket's sitting on its side, your ability to handle your daily stressors becomes quickly reactive. So as people get farther along, with Lyme, they tend to become more and more and more allergenic, and arguably more and more reactive as an autoimmune response. And when it does that, you drive way higher level of cytokines or pain mediators, poor circulation. So this is brain fog, cold hands, cold feet, cold nose, cold toes kind of symptoms, energy depletion when you don't oxygenate well, and then you start leading to symptoms at the bottom there. So symptoms can be anywhere between, joint pains and inflammatory responses. These are just a few of them that we talk about down here. So when the alarm goes off, summary, you have an immune suppression, you have elevated inflammation or cytokine signaling. They talk about that a lot with COVID now, with the cytokine escalation in the lung tissue. It's the same response, or the same pathway, I should say. You get a reduced blood supply because inducible nitric oxide goes up. So we start to see that a lot. The brain doesn't do well when there's a lot of inflammation. There's poor oxygen or blood supply. And then you start seeing a shift in the system because the adrenal glands are the primary stress control mechanism. It's called the HPA axis. So when you start seeing a chronic stress response, that gets weakened, and then your body starts to shift into its reserves, and that's the thyroid axis and the hormonal axis. So we often see chronic Lyme end up as a hypothyroid-like response, or with men, low T is a very common thing, with women, estrogen issues and progesterone. And then that leads to different symptomatology. And then, of course, there's a mitochondrial dysfunction. So when you see this alarm, it ends up with a chronic fatigue state, there's other things that we always talk about, but focusing back to mitochondrial dysfunction specifically, this is the master protein regulator for the body. It's called PGC1 alpha, and that's the names for it. So what does that mean? Why is that important? If you have low PGC1 alpha, you pretty much have low energy. You actually will have difficult time falling or staying asleep often, poor energy production, chronic inflammation, difficulty losing weight because of the hormonal shifts. It's an important primary modulator in the mitochondrial recovery. Biogenesis is basically recovery and function. It's important in energy metabolism, fat metabolism, weight loss, blood pressure, cholesterol homeostasis, detoxification, circadian rhythm, a whole bunch of different things. It's very protective against neurodegenerative diseases and inflammation. Inflammation elevations, and it reduces insulin resistance. So basically helps to keep us healthy, and it's a signaling protein to the brain, okay? So simply, this is the thing that we want to get higher and increase in our body. So I'm going to challenge a little bit with the next slide. Oh, there we go. I know this looks busy, so take a deep breath, and I'm going to piece it out for everybody, okay? So here's PGC1 alpha, and this is all in the brain right here. So all of these things in the brain, if they're in, balanced or in healthy responses, it leads to healthy recovery for the brain and increases anti-aging, healthy brain responses, healthy control. So we want anything we can do to increase mitochondrial recovery increases PGC1 alpha. This pathway tends to be the more dominant pathway as far as that I've seen, and it's called the SIRT1 pathway. So for those of you that are advanced in all this, this is the anti-aging pathway. And back in the day, resveratrol has been a very strong way to help with anti-aging, which is why it kind of came out. So in these blue boxes, or light blue, I should say, these are things that are more productive in the different pathways. Now, I don't have an answer as to which patient has the more dominant pathway, or if you have 3 or 4 of these pathways. What we're collectively trying to figure out is a way to say, you know what, you're a patient that I think has more of an imbalance in the poor to good energy ratio. You probably have more of an AMPK pathway. I bet you would do great with HBOT. I would love to be able to say that and be more clinical with it, but I just haven't figured that out, or we haven't figured that out specifically for patients. However, these are arguably the pathways that help to stimulate those recoveries for people that have tried the HBOT or tried pulsed electromagnetic and have seen success with it, with getting their bodies and their life back and recovering the mitochondria. Now, I've had patients that have done these, and we've worked through a lot of this that have had a little bit of success or no success, and we'll keep working through that. But this is where we're at clinically. If you can see here, that I always say there's 1A and 1B things that you can do that are really, really good. And exercise is by far hitting 4 pathways. The challenge with that is people with chronic Lyme don't have the ability to exercise because they have a lot of pain or they're just too tired. So what else can I do? Well, 1B that we've been seeing a lot of is photobiomodulation light therapy, otherwise known as red light therapy. And we have a unit in our office, it's called a Juve unit. And red light therapy, which I'll show you in some slides later, has been very successful into helping people recover that. And as you can see, red light therapy helps with 1, 2, 3, 4 pathways. So it gives you really a lot more energy, or a lot more kind of bang for your buck when you do that treatment. Hyperbaric is 2 pathways, or excuse me, 3 pathways. It helps the brain a lot. So if you look through this, there's different things that patients can do. And when you hear like, hey, I had a friend that did calorie restriction, they did great in helping their recovery, arguably it's those certain pathways. It does not work for everybody across the board. It's always individualized. So I go back to nobody's perfectly healthy when they get bit by a tick, and your genes matter. So these are a lot of genetic expressions as to how and why these pathways are more dominant in any one individual. So some of these things you can do at home. Calorie restriction has been helpful for people. Certainly weight training can be helpful for individuals if you can handle it. So you get the gist of that. In these green boxes, or excuse me, like light green boxes or whatever, these are different supplements that have been more specific for these pathways. Amino acids and quercetin, cinnamon, lithium low dose has been really helpful for the brain pathways. Quercetin's been really successful. We're starting to use a lot more of it. It's a T cell receptor down regulator, but it's been really good for these pathways. But we use it on a lot of our patients that have had COVID, and even with COVID recovery. But it's the same understanding that we want to recover this pathway and the cytokine pathway. But it's been really helpful. So we encourage everybody to take that, not only with COVID, but with chronic illness. So if you haven't tried some of these things, this is where we're at. I'm not going to get into them too much more than I think this slide. Certainly, if you have questions at the end, I'm going to try and leave as much time as I can with questions. We'll go through them. So I put these gold boxes in here to explain the pathway. And then in literature, and when I come across different things in the literature, I kind of add to this. But these give a little bit of a key as to where a patient may start. I'm trying to work with this. This is just kind of where I've ended up right now. So I hope that doesn't overwhelm you and gives you a pretty good idea. This is my pathway for mitochondrial recovery and what you can do at home and what we can do in the office. And then certainly with blood chemistry and other things, not that I can see blood chemistry give me an idea of these things, but it gives me an idea of thyroid function and gut function and things like that. So we kind of correlate all of that and to move forward with hopeful recovery and pre-Lyme status for all of you. So let me move on to the next slide, and we'll take questions, of course, after that. All right, so what can you do on your own? So types of home care, self-care, physical, emotional, social, spiritual. What can you do on your own at home? These are the top 10 supplements for mitochondrial health. These aren't set in stone, but there's a lot of them on here that we use on a regular basis. I shouldn't say set in stone, but 10 of them aren't necessarily set in stone. CoQ10 is definitely something that's very, very specific for energy and energy recovery. If none of you have tried nicotinamide riboside or NAD, this supplement is really helpful. I'm going to go back to this page here. NAD and nicotinamide riboside are really helpful for this pathway. And we offer an IV of NAD and nicotinamide riboside, which has been good for most patients. There's some that don't do well with it. Again, we're working through some of that, but for the most part, nicotinamide riboside is really helpful in stimulating mitochondrial biogenesis, especially in the literature, it's talked about that. But as we age, it declines up to 50%, especially between the ages of 40 and 60, and it helps to accelerate aging when it goes down. So certainly it's a good way to help to increase. We do have a supplement for home or oral intake. Amino acids are building blocks. Some vegetable sources are here, beans and quinoa, but it's mainly in protein. Creatinine, liver and the kidney, pancreas shown to aid in muscle regeneration, mitochondrial regeneration, and anti-aging. Alpha lipoic acid. PQQ is a more kind of a higher source of CoQ10. For all of you chocolate lovers, it's really high in cocoa powder, not necessarily chocolate itself. But wouldn't that be great if we could just take a bunch of chocolate and get better, right? or cocoa powder. Encourages mitochondrial growth, short-term memory, anti-aging, immune support. B vitamins are really important for the citric acid cycle. Taurine, we use this a lot with patients with anxiety and other kinds of amped up brain, like nervousness and things, and depression to an extent. So this helps. It's a form of specific amino acid. Resveratrol, we talked about a little bit. It's high in red wine, grapes, and berries. It's very anti-aging. D-ribose is a foundation for mitochondrial building blocks. I've used this a lot. We use it a lot with our weightlifters and people that can, do a lot of weight training. Not one of these, in my opinion, is the answer or the only answer. It's a combination of all of them, but it doesn't mean you need to take all of them to get better. So it's a conversation on which ones would be more specific. And again, I go back to this to say, okay, which one could possibly help better so that we don't have people taking, more things than you actually need. The nice thing is that you can take a supplement that has a lot of them in it. So this one's from Research Nutritionals. It's called ATP 360. I use it a lot as a foundation for mitochondrial recovery, so you don't have to take all of those things in different supplement form. There's a lot of those things in here already, so I like this product a lot. So I wanted to just give you some idea of what you could do on your own if you could find, get that. We have it in our office. This talks about resveratrol. It's high in blueberries and grapes. And the pterostilbenes and resveratrol themselves are both really helpful. Pterostilbenes are very similar to resveratrol. This is a study and talks about that AMP1 or AMP kinase and SIRT1 pathway. I'll go back and show you the exact pathways if you forgot. But this talks about in viruses and how it inhibits viral production and protects the neurons from neurodegenerative effects triggered when you have a herpes infection or an HSV1 infection that can affect the brain. It talks about resveratrol, quercetin, that are natural activators of SIRT1 and AMP kinase, increases the viability of infected neurons and significantly reduces the viral titers, which I thought was pretty significant and kind of a great little thing to show you that there is literature out there. I didn't put a lot in here, but there is literature out there that shows that stuff works. And so it's kind of where I start adding supplements in here, but you can see the pterostilbenes, resveratrol, and quercetin is really good for this pathway. Ketogenic diet. So those of you that have tried this, some have a lot of success, others not so much. But I have a patient today that I just started on a ketogenic diet because she has PCOS. And then she's a mold recovery patient. And so she's struggling with the cell danger response because every time she eats sugar, it just amplifies her response a lot. So this is a perfect way to help because it's very low sugar. Heavy fat keeps her full. And it's also really good to help to moderate and help with the mitochondrial recovery. So, low carbohydrates, high protein, high fat, but your glycogen or your sugar levels, which would stress the mitochondria to an extent, can go really low, certainly when you have a ketogenic diet. The metabolic switch from using glucose to fatty acids or fats or ketones for fuel upregulates the SIRT pathway. That's that top one. Studies have also shown that the SIRT3 pathway is being able to increase mitochondrial numbers. So sometimes this is a really big step into helping you move forward, trying a ketogenic diet. Not a tough diet, certainly not an easy diet. Some people kind of go back and forth, but you really shouldn't. If you stick to it, you got to stick to it. Intermittent fasting from that, that slide that I had shown you before talks about intermittent fasting. If you haven't tried it, there's different modifications of it, but simply you fast for 16 hours, you eat for 8 hours, you try to eat more ketogenic or healthy fats. But the intermittent fasting helps the circadian pattern, and your body will then go and burn fat for energy, keeps the glucose levels low. We also do a modification of this being 18-6, if you can get to that, where you're only eating a 6-hour window every day. Intermittent fasting certainly has been beneficial. So what is therapeutic fasting? It's a procedure where you voluntarily go without food for a period of time, 16-8 or 18-6. It's important to emphasize that the fasting isn't the same as starvation. Certainly you want to eat. In simple terms, you stop eating and eventually leads to ketosis, which your body burns fat. Instead of relying on fatty acids from foods, on a ketogenic diet, therapeutic fasting causes your body to break down its own fat cells. It's best to do this with more of a skew towards lower sugar when you do eat. In any event, how do therapeutic fast levels increase mitochondria? When your body's energy demand is high, but energy stores are low, your body produces a molecule called AMPK, which is the bottom left pathway I talked about. Studies have shown that AMPK has stimulated new mitochondrial growth, but even greater therapeutic fasting is that it induces a protein or process called mitophagy, which is increasing mitochondria. Okay, so it helps the old clear out the old, and then cleans up. When you clean up the old, your body's allowed to make new. Exercise is really the biggest key. I've seen a lot more success once we can get people to exercise without feeling like it overwhelms you. It really, really, really helps to keep you healthy and keep the Lyme disease at bay, or at least the symptoms. I've seen so much success once we can flip people into a functional exercise, get better. Resistance training is certainly of benefit as well, gaining muscle. Again, start slow. I know that there's some of you that are out there that are looking at this going, oh my gosh, I can barely even walk down the steps. I get it. But these are our goals. Others that have tried everything, if you haven't tried some of these things, but you've seen success with others, try some of these things. They certainly can help. I've seen some pretty amazing stories on just some of these simple changes, which is a lot of fun. And then stuff that we have in the clinic. This is our clinic in Mechanicsburg. There's our phone number in case anybody needs to call. But the clinic stuff, chiropractic, I have to give a shout out to chiropractic since I am one. It's really good at increasing neural function because it takes away pressure to the nervous system. It's not just for pain, but it increases neural function. So you tend to increase sympathetic nervous system and parasympathetic nervous system balancing. So it's a big improvement for health, sleep, stress, happiness, well-being, immune system strength, mobility, life, and then certainly decreases aging, pain, aches, or whatever. So pain being a chronic stimulator of the cell danger response, well, anything we can do to reduce pain is only going to help you. So if you haven't tried chiropractic, it certainly helps in these situations. Red light therapy, we talked about that before. This is what ours looks like. I didn't actually get a picture of the one we have in our office, but this is exactly the one that ours looks like. I have had patients buy one for home use that are a lot smaller. There's definitely successful. You want to try and do these regularly. The little units you do 20 minutes every day. Certainly it's hard to do this one every day, but the bigger units you need to really only do, it looks like maybe twice a week. But it's the consistency that looks like this is what helps stimulate the biogenesis of the mitochondria. And from what you remember, there's 4 different pathways that this helps. What does it look like? Well, there's all these different things that can help in the brain. Most of these chronic Lyme cases end up being a brain-induced cell danger signaling that tells your body to stay stuck in fight and flight. So hope that made sense. But it's that alarm phase that we need to calm down. And sometimes it's just the brain trying to protect you. So if you can increase neurotrophins, so brain-derived neurotrophin and then growth hormone functions, these things really help. This can help that increase that naturally in the body. It reduces excitotoxicity when the body just kind of goes fast and things don't work right. That neuroexcitotoxicity certainly is a problem. It increases blood flow. It reduces inflammation, helps with healthy aging. These are all healthy aging things. So all of these really good things is for red light therapy. And really it's the hypothalamus. So I always encourage patients to kind of have it go at the top of their head right here, helps hypothalamic, which is part of the aging or part of the stress axis rather. I'm going to try to give you a visual rather of how it helps. The light beam, the red light, is a specific nanometers where it goes down enough into the cell that it increases the mitochondrial function. So a little visual, not to get into all of this, but it helps the body increase the healing and the production of mitochondria. Peptide therapy. We have had some great success with peptide therapy, both for immune regulation. If you've never heard of this, they're protein fragments that help with resignaling of the brain's response. immune regulation peptides, weight loss peptides, energy production, sexual function, tissue repair, regeneration, reduced inflammation. And then we have one now for mitochondrial recovery, which has actually been really helpful. So we've just started to use that. For those of you that are patients of ours or patients of mine, remind me, we'll talk about that. But it's been impressive. But the one peptide that I've used a lot is called thymosin alpha 1. And that one helps to, if you can see me, helps to stimulate that seesaw effect and helps to increase the immune system recovery. So now we have a peptide that helps to stimulate mitochondrial recovery at the same time. So that's really exciting news. And we also have IV therapy. We use a lot of this now. There's for NAD IV, we have an immune IV, energy, and then all of them hydrate. One of the things that I've found is that a lot of the chronic Lyme patients end up being very, very dehydrated, and or they get coagulation issues. So circulation, blood circulation, and hydration has seemed to really help turn that cell danger response off. Again, we've seen that a lot, not necessarily as an initial cause of Lyme, certainly, or initial stages of Lyme, but it usually comes around afterwards for whatever reason. But it's been very helpful in people getting their reduction of their symptoms. Hyperbaric oxygen therapy, HBOT. We have this chamber in our office in Mechanicsburg. This has been very helpful. There's a bunch of those pathways three of those pathways in the brain that it's helped. I have a gentleman, he put a testimonial on our website, but had a really hard time, chronic Lyme, fatigue, couldn't use his arm and his leg very well, was cramped up, and had litany of tests and procedures and treatments, and put him in the HBOT, and within 2 chamber sessions, he was able to walk without his leg and his arm immobilities. And it was extremely exciting. Certainly, I'd love for all of my patients to get in there to have that kind of a response. But for him, this is his key. He just does his HBOT I think it's every couple of weeks, maybe every 3 weeks, and everything kind of stays calm. His brain does really well. Certainly still supporting mitochondria with some supplementation, but this is his key. He's done really, really well. He's got his life back because of that. So if you haven't tried these things, you need to give it a shot. Typically, most hyperbaric chamber sessions, it's 40 dives. A dive is considered to be an hour within a short period of time. In the autism world, it was always 40 dives in 40 days, which I think is pretty much impossible. But oftentimes they talk about doing 5 dives a week. We don't necessarily do that. I usually try to encourage patients to do 2-3 dives a week for a while to try and keep the consistency. You can rent home chambers. If you're interested in that, we do rent them. And you can buy your own if it works that well. The other thing that we use now that I was very suspect to this actually years ago, I should say, suspect of this working. However, it's been extremely impressive on how well this works. So we have a ionic foot bath / pulsed electromagnetic Juve and foot massage package that patients do. That's people really, really like, and it really helps with cellular detoxification and helps to release heavy metals and toxins. So it creates less reason for your body to have alarm in this way. If you've tried it before, maybe try it again. If you haven't, I would certainly give it a shot. You can get these units for home. I'm not a big fan of having patients jump into buying these things to see if it works. So, if it doesn't work, you necessarily haven't wasted your money, but you don't want to do something if you don't want to buy something if it doesn't necessarily work. But this is an inexpensive way to look at these things. This isn't that expensive, but that has really, really helped a lot of our patients as an adjunctive procedure. So we do offer that in the office. I think that was, last one. Our pulsed electromagnetic frequency mat, it helps to oxygenate cells, improves energy, promotes healing, reduces inflammation, weight loss. The main thing that I've seen with this is it really helps to reduce pain. People lay on it, they fall asleep typically. Some people can't handle it, which is a little crazy, but so there's different settings that we've used, but most people do really well with it, and it really helps as an adjunct. But a lot of times I'll encourage this in conjunction with our hyperbaric because it helps to oxygenate better when you use them both together. So, yep, I think that was it. There's my family, and I thank you very much for time. I tried my best to leave some time. I hope I didn't go too fast, and I'm able to take questions. So thank you for your time.
Well, thank you very much, Dr. Smith. We have a lot of questions coming in, so I will consolidate them and try to get
go
through.
back. I'm going to go
Yeah.
back to that one slide. So I'm having a feeling that might be our start point, but there we go.
Okay. So the first question for doctor, is there data that suggests early diagnosis of Lyme disease leads to better outcomes? And do you have a reference for such a finding?
Yeah, one of the things that we always say is, nobody's perfectly healthy when they get bit by the tick, but your past experiences, your health at the time of illness matter, your genes matter, but the length of time as to when you got diagnosed certainly matters. When you allow the infection in the system and amplify that alarm, inflammation, immune dysregulation, and allows the Lyme disease to kind of get cellular, it definitely is a little bit more challenging to get it under control. It doesn't mean you can't get better. It's just a little bit more challenging. So we always want patients to get tested, and with proper testing, as far as what we're concerned, to show that you have Lyme, and the quicker you can treat it, the better for sure. Is there data out there? I'm not remembering any specific research data, but I know that there's, it's definitely been talked about over and over again, even with ILADs, that it's, you definitely want to try and get to it before it gets to you, kind of idea for sure.
Okay, very good. Next question. Could the doctor discuss PBM red light therapy a little bit more?
So photobiomodulation, big word for red light therapy. So I guess this is the easier way. So there's different light therapies that you can have, but none of them get down into the intracellular tissues inside the cell to stimulate the mitochondria. So the light itself is this different nanometer, and it penetrates into the cell enough that the mitochondria starts to replicate faster. So it's called photobiomodulation, meaning that it helps to, with light, stimulate mitochondrial recovery. The literature out there, I didn't put any of my literature in here, so I could have shown you some of the different stuff. But if you go to pubmed.org or pubmed.gov, I guess now, and put in red light therapy or PBM therapy, you should be able to see some literature out there. I don't know how much, I know there's not a ton yet, but there's definitely literature. Or even if you go onto the Joovv site, Joovv, I believe is the way you spell it. They have a lot of links to the different light therapy research articles and things on there. But it's just a way to help to stimulate through that photobiomodulation, or that penetrating light nanometers into the mitochondria. And it's into the mitochondria of the brain that stimulates all of these really wonderful things for brain health. That's the easiest way I guess I can explain all that. Otherwise, it's going to take me an hour to go through the details of it.
Okay, I'm getting a few questions that are pretty specific to people's specific health problems. I'm going to try to make them as general as possible, realizing you can't give up a diagnosis over the webinar here. But I have somebody who's asking about the link between Lyme disease and hearing loss. This person is apparently suffering from hearing loss, balance problems, had an MRI, did not show anything major like a tumor. And this person just wants to know, they have not had a VNG test, but they read that Lyme disease could possibly cause hearing loss, and they want to know your thoughts on that.
Yeah, so that's, I mean, there's a bunch of different pathways that kind of jumped into my brain in response to that. I mean, overall, Lyme is a great imitator, so it can mimic and imitate anything. But when you look at it specifically, if it is specific, in your case for hearing loss, I would say a couple of things. One, the mechanism for that could be circulation to the brain. So that's this pathway here. So stress bucket, overload, dysregulation, Lyme suppression of Th1, drives cytokines, poor circulation, oxygenation and circulation into the capillaries, goes into the inner ear. So there's blood supply that I would question. Brain inflammatory, immune inflammatory responses to the actual brain itself to control hearing could certainly be that pathway. those are kind of the primary things I'm thinking of, because it's the different cranial nerves that control hearing and or the inflammatory immune responses would be the things that I could say definitely could cause that. Do I see that on a regular basis? Not necessarily, but I've seen crazy symptoms with Lyme, um, you know, a lot. So
Right, right.
but that's what I would think of that.
Okay, here's another person they've gone into a lot of detail about their symptoms. I'm going to summarize the best I can, but this person was diagnosed over the spring and summer, had a lot of Lyme disease symptoms, eye droop, shooting pains, joint pains, headaches, shortness of breath, neck stiffness and pain. This person was very sick and ended up going to the hospital, was treated for Lyme disease, it sounds like, for a short period of time. Post-treatment, still experiencing dizziness, fatigue, shortness of breath, brain fog, reactions to alcohol. Went to an infectious disease doctor who said there's no need for any further testing or treatment for their Lyme. And they're kind of asking where to go from here. Do they believe that infectious disease doctor? Do they do something more for their treatment? Do they just do something self-treatment? That kind of thing is the question.
Well, I wouldn't say do self-treatment. I would say find somebody that's going to listen to you and help you with your your remaining symptoms, not necessarily just treating the symptoms, but trying to get down to the root of the cause. The couple of things that popped out, one would be, did you ever get treated or tested for babesia? Because that's usually air hunger. That would be the first thing, or co-infection. So Lyme, if you treat it for Lyme with an antibiotic, it doesn't necessarily treat everything. Bartonella can certainly give migrating joint pains. I think you said migrating. Bartonella doesn't always go away with doxycycline. So you have to kind of look at the treatment and then the amount or the types of infections if they tested you correctly. So I would say get an advanced test, a Lyme test. We don't use hygienics all the time because it's super expensive. The other ones that I use more regularly, Vibrant Laboratories and then medical diagnostic labs have pretty good tests that we can kind of look at those. There's others out there. Those are just the three we tend to look at. And then the other thing is, you said you get, I think they said that they get lightheaded and dizzy with alcohol or alcohol intolerance. Yeah, that's a classic sign of mast cell reactivity. So mast cell disease or mast cell reactivity is when this side of the immune system is so high and this side's so low that this is an allergy side of the immune system. When this kicks in, you drive histamines and mast cells. Mast cells are primarily in your gut, brain, lung, and skin. So your barriers or your borders. And so when you have barrier breakdown, leaky gut, leaky brain, asthma, cytokine inflammatory response to the lung, rashes on your skin and things like that, or eczema, mast cells start to become really reactive. So one of the things, mast cell activation syndrome, is a huge set of symptoms that's typically, well, I shouldn't say typically, it's common in long-standing Lyme patients because of that ongoing unfortunate immune shift that people can get. So as this goes on without being supported, then you start having a patient become more and more allergenic. So mast cell reactivity, so signs of mast cell, alcohol intolerance, exercise causes vertigo or dizziness, lightheaded or getting lightheaded or passing out with hot showers or sunlight exposure. Acid reflux can be a part of that. Chronic joint pains can be part of that. Hormonal dysregulations, itchiness, weird itchiness that waxes and wanes, sleep disorders. There's a whole bunch of different things. So patients can end up in a mast cell reactivity, and that's arguably just because your body's stuck in a fight flight and those cell danger response signalings are telling your body to do that, and it ends up as a histamine mast cell problem. So I would say get somebody that's pretty knowledgeable in mast cell reactivity, post-treatment Lyme. Do you believe you're infectious disease? Yes, but they don't typically have all the answers, because once you get treated for Lyme, you're fine. It's not from Lyme anymore. It's something else, which I totally disagree. Those of us that have had experience with Lyme, or that you have chronic Lyme, it's not in your head. It's definitely a response to the Lyme. It becomes an immune dysregulation, a mitochondrial dysfunction that turns into a cell danger response signaling that tells your body to stay stuck in fight and flight and it shifts this regulatory function into more of an allergy response, ends up as mast cell, which drives a lot of different symptoms. So that's the cascade. So you're classically telling me that you still have something going on, whether it's your body's immune system that never has been treated correctly, or you still have an infection that didn't get under control.
Okay, we have a
Hope
question.
that wasn't too long-winded.
No, that was great. Thank you. We have a question from a person that calls themselves www.palyme.org. Sounds fake, but is it true that red tomatoes create inflammation and are not Lyme diet friendly? And can this person occasionally cheat?
Well, that goes into the nightshade family, and so we frequently encourage people to get off of nightshades because they're pro-inflammatory in these kinds of immune cases. What I always say is if your bucket's perfectly upright and there's nothing going on, your body's handling stress, you can throw any type of a food in there, that even if you're having a small allergy, and you'll never know that it's there. Fast forward to massive amounts of inflammation, a huge bucket overload with Lyme and all these other things, or an immune dysregulation. Now tomatoes that are the same reaction now can drive the reaction. So we tell people all the time to go more so on an autoimmune paleo diet, which includes not including nightshade, or not includes eliminating nightshades. So do tomatoes create that? Yes, but it doesn't always mean that that's the answer or the problem only, but arguably anything that tells your body or your brain to drive a response or turn that alarm on brighter would be something that would make you more symptomatic. You don't want to turn the alarm on more, you want to turn it off. So anything you can do to remove foods that might be reactive as an allergy response, you want to eliminate them. So tomatoes would be high on my list to look for.
Okay.
Eliminate.
Any certain tips for buying a home unit for red light therapy? What to look for?
I encourage a lot of my patients to go. I mean, it's a different company that we use. And I know Juve does have them, but I think that they're a little bit pricier. But there's another company called Mitored, Mitored, and they have a Mito Mini. I think it was on sale for $239. I think it's like 18 by 18 inches, as far as I remember. But it's been very, very helpful and easy. A lot of my patients will put it on their nightstand, lay on the side of their bed, so that it kind of goes at the top of their head, watch TV for 20 minutes by just laying on their side. And it's very helpful. And you can move it around to different body parts. Excuse me. I know that you can do that one up to 3 times a day, 20-minute intervals, but you have to change the body part.
Okay, here's a question. I'm going to try to summarize it. This person has had Lyme for over 2 years and has treated with both antibiotics and herbal supplements. Kind of a loaded question. Currently, what do you think is the best combination for Bartonella, ehrlichiosis, and Lyme? Also, this person's mother had TB years ago, and this person always tests positive for antibodies. Can this skew any Lyme-related lab results?
Positive antibodies for what did they say?
For TB.
Oh.
Yeah.
We don't have a standalone treatment specific for Bartonella or any one type of combination of antibiotics, but we've really, the medical doctors in our office have really honed in on more of methylene blue as a really better treatment for Bartonella, but they also combine it a lot with rifampin. So that would be my answer for Bart, if you can handle it. And then certainly there's so many different types of antibiotics depending upon what people can handle or have an allergy to. But we have used disulfiram, which came out, I don't know, about a year ago or so, 6 months, with some pretty good success. It's pretty rough on the system. And then the other one, Dr. Horowitz talked a lot about his dapsone therapy, which is more for malaria or intracellular Lyme. We've had some success, or a lot of success, with dapsone. Both of those you have to really, really be managed pretty regularly. You need regular blood chemistry because you can get anemic. But the traditional ones, zithromycin, doxycycline, Plaquenil, I mean, there's different reasons that they're used. They have to be individualized. Did I answer that whole question? Oh, the IgG or the antibody. If you had a reaction to tuberculosis, it doesn't mean that you'd still have it. It could be a titer. It depends upon other tests. The blood chemistry that we run, We run a lot of immune marker tests that we've kind of adopted from cancer testing, but it helps tell us T cell regulation, Th1 status, naive T cell or T receptor status. So we look at those to tell us a little bit of a better idea of where we go with immune, treatment and support. C4A, C3A, for those of you that don't know, those are the ones that we use a lot. They're not specifically for Lyme or mold, but we use them as immune inflammatory regulators. I always look at them as how hard is the alarm going on, or how heavy is the cell danger response going on, and are you making progress? So we have other ways to kind of look at if those antibodies are in the background causing an immune problem, or they're just titers.
Okay, next question. Top 3 supplements for chronic body-wide muscle pain and numbness.
Oh goodness. Turmeric, liposomal turmeric, resveratrol, since it's a cytokine downregulator. And then depending upon why, that's a tough one, but quercetin, I would say for sure. The challenge that becomes if it's, you're not having good detox, and if you're a slow methylator, then I would say like methylfolate. SPMs are fractionated fish oils that help with cleaning up debris fields from like a die-off standpoint. So if you have chronic systemic pain like that from a detox standpoint, then detoxification stuff would be better. That's a tough question, but those are the top 3 I would pick off the bat.
Okay, here's a question from.
I wish that was an easy question though, right? What's the top 3? And everybody helps, but everybody's better. But that's not that simple. Sorry.
Nope, no problem. We have a question from somebody that I know very well. Hi, Debbie. Miss seeing you at the meeting since we don't have them anymore. She's asked a question that I hope I can pronounce correctly. Have you treated, here it goes, have you treated myasthenia gravis? Hope I said that right.
We have had patients that come into the office with myasthenia gravis. Certainly we don't have a lot of them. And it goes back to the immune regulatory pathway right here. And, any type of autoimmune or immune dysregulation, you got to downregulate inflammation, downregulate cytokines, and tell the brain to calm down that cell danger response. So yes, any type of problem that's related to the immune system and or the autoimmune response we've seen. So we have tons and tons of, we don't just have Lyme patients, we have Hashimoto's and rheumatoid arthritis and ALS, Parkinson's, chronic fatigue, you name it. So yes.
Okay, any thoughts on cold laser therapy?
It's similar to the photobiomodulation red light. It's a little bit different, but it works good. And that's the general gist. A while ago, when I was just a simple chiropractor, we used a lot of that for tissue recovery, tissue regeneration with injury. And that was the idea behind it. So these new red light therapies that are whole body have kind of taken that and amplified it. But it's definitely worked. I have a colleague of mine in Pittsburgh that does laser therapy, and he has settings that he uses and says that really helps resolve his Lyme patients, or help to resolve them, I should say. I haven't kind of dug into that and kind of met up with him yet to figure out what that is specifically, but he's the only one that kind of has told me that. So, but it helps.
Okay, next question. Is there a reasonably priced ionic foot bath for home use?
Ion Cleanse, I believe, is the decent one. And I don't remember the cost of them, and I apologize. I really haven't looked at the pricing. From what I've been told, they're not super expensive, and I can't even quote a price. I'd jump on the internet here, but I don't want to mess up my thing, but I apologize, I don't. But I believe it's Ion Cleanse. If you Google Dr. David Dornfield, and if he's listening, hi, Dave. He's out of New Jersey, but he speaks for, I think it's Ion Cleanse Company, and he promotes their product. And I know that product is really, really good. I think it's Ion Cleanse, and I apologize if I'm wrong. But if you Google his name and, it's Ionic Foot Bath, you'll probably see the company that he talks for around the country. He's a medical doctor. So, but anyway, that company is really good. Let's forget them.
Do you have a PEMF mat that you use that's affordable for home use?
We have one here. There are, I mean, you can buy them. The Beamer mat is a very common one that people buy. Their claim to fame is that their pulses change all the time, and they say that it helps the body a little bit better. But I know the other ones, we've seen success with a lot of them, but you can get them for home use, yes. Are they reasonable? They're a little bit more expensive. I know some of the mats are 800, some of them are a couple, 3,000. The cheaper ones aren't necessarily any, worse or better, but there's different things about them. I would 800 to 1,000 is not a bad one, but it's still 800 to 1,000. Can you get them for home use? Absolutely.
Okay, next question. Have you had patients that developed atypical trigeminal neuralgia from Lyme?
Yeah, Bell's palsy is a classic presentation. But trigeminal neuralgia or facial pain, absolutely. But Bell's palsy specifically is a classic sign of undiagnosed Lyme. It's an early sign of it for sure. Out of nowhere.
Okay, how do you measure level of the mitochondria? Is there a specific blood test?
Boy, I would love that, wouldn't I? I mean, that'd be great. No, I apologize. There was a company that we were using that we thought we could figure it out that would test the 4 different complexes of the mitochondria, and we were hoping that it could give us an idea of how to help people and then look at it as a biomarker. But I don't have something that tests for that. I would love it. That'd be great.
Okay, next question. Is far infrared sauna somewhat akin to PBM red light therapy?
It's a little bit different, but far infrared sauna uses, it's a kind of a detox thing. So you sweat a lot, and that detoxification and the extra heat actually stimulates that recovery component. So it's a little bit different. It's not the same wavelength, but it's still effective. The challenge with the challenge with any of these, you can herx if you don't support the pathways as a whole. I've had patients herx on hyperbaric, and in all of these, actually, I've had people herx. You have to be careful with doing too much too quick. However, far infrared saunas are great as far as a cellular detoxification. If you haven't been checked for detoxification pathways or methyl SNPs, you probably should, just to make sure you can handle it, depending upon the amount that you do. So we check for what's called MTHFR SNPs, and that's actually a test that we can run through LabCorp that's covered by most insurances. So that's great.
Okay, next
Ever
question.
hear that, Bill?
Yes.
Okay, I'm challenging you now.
Sorry, I'm reading it.
Ever hear that,
Bill? Sorry, I get
No,
distracted. I'm looking at all different
I
places.
know. I'm I'm talking to a screen. I could just see you. So it's like, did you ever hear that? I feel like I'm just talking to you.
Sorry, I should pay closer attention.
No. I'm just teasing you. It's fine.
What could help with bladder excitability caused by Lyme?
Berberine is really good for the bladder. If it's an acetylcholine issue from the brain that creates an excitotoxicity, phosphatidylcholine, phosphatidylserine, magnesium. But if it's a bladder excitability and it's like interstitial cystitis kind of stuff, that's mast cell classic. So then you go into like antihistamines. I'm not a big fan of the over-the-counter stuff ongoing, but quercetin's really good antihistamine. That kind of an approach. But berberine and I would say antihistamine, quercetin and stuff.
Okay, next question. Could you recommend a natural stress reliever?
Ashwagandha, CBD, taurine, valerian root, passion flower, frankincense. Is that enough? There's so many. Everybody's different. We have like about 30 different supplements for calming down the brain. Oh, Relora is really good. It's called Magnolia officinalis herb. I have a product called Cortisol that's really great. I usually use that a lot. That kind of stuff.
Somebody is asking on Facebook, can you put the self-care slide up for a little longer? Maybe you could flash it one more time before we conclude tonight.
Yeah, I'm sorry, I got stuck on that one. This one, I'm assuming?
I think you had one that had 4 columns for self-care, I think.
Oh, that.
Yeah, that one. Yeah, there you go. And then while you leave that up, I'll ask the next question. How often do you see patients with connective tissue hypermotility issues such as EDS, hypermotility, or other connective tissue mutations?
We have a lot, I shouldn't say a lot. We have quite a few EDS patients, but that goes back to that dysautonomia, umbrella, and mast cell reactivity. So it doesn't mean that if you have mast cell, you have EDS, but if you have EDS, you're very likely to get mast cell when you get Lyme or if you get some kind of a chronic issue. So, but we have quite a few. I don't know how we have a lot of patients with mast cell reactivity, arguably because we have a lot of Lyme patients, but we see it a lot.
And then the follow-up question to that is, do you treat those patients any differently?
Well, we try to treat everybody individually. And, as challenging as that is, but it depends upon so many different things. The easiest first question, no matter when a patient, how they're coming in or what they're coming in for, number one would be, are you an immune patient or an autoimmune patient? Number two would be, if you have Lyme, is it still there or is it gone? And we have to help regulate the immune response. And so those two things, since this is a Lyme talk, then that skews the testing, in my opinion. Like, okay, is there mast cell reactivity? Is there circulation issues? Is there oxygenation issues? So what types of blood work would I look at to see how we can help best help that patient? But as far as individual, it certainly helps when someone comes in and say, hey, I have EDS, then you kind of go that path. Or if I have Hashimoto's, and then you can see those things and understand what you're looking at. So it does help, that start point, but then it becomes more of a question that goes like, we always look broadly on the reactivity component of it. So you may come in with a thyroid problem, but it's also leading to a hormonal problem, which then led to a endocrine problem, which then leads to all these other symptoms. So we got to look at all of this to say, how do we help downregulate everything, and what are the best ways to treat the patient and or support them so that everything calms down, and really not just treat your symptoms. I mean, we're really big on cause and cause related. Now, challenging with that is you have to treat symptoms when people come in with chronic issues to get them to calm down. But our goal is to not keep people on stuff forever, or a ton of stuff forever, I should say, and really focus on the things to keep them protected, and to keep them, once your journey gets to a point where you feel better, let's keep you here and not allow you to kind of go back down. So that's the challenge. So everybody's pretty individualized.
Okay, I had a question about intermittent fasting, and it seems to have disappeared on me from Facebook, but if I can remember what it said, it was when you're doing an intermittent fast, does it matter if you're on or off antibiotics? Should you do it off of antibiotics?
I don't have a great answer for that. I don't think it matters.
Okay.
I could be wrong, but I don't think it matters.
Okay. Oh, someone's asking, you referred to the term EBS. Did you mean Epstein-Barr syndrome?
Oh, EDS.
EDS. EDS, yes, okay.
Sorry, I stutter. That's for my wife. She tells me I stutter.
Okay. We're getting toward the end of the questions. What about co-infections that linger after Lyme is gone when immune system is down?
Say that again. What about co-infections that linger?
Let me read it again. What about co-infections that linger after Lyme is gone when immune system is down? I guess what they're saying is their immune system is weakened and the co-infections are lingering.
So it goes back to the cliche statement I tell everybody: nobody's perfectly healthy when you get bit by a tick. Your health matters, your past experiences, your genes, but what types of infections and how many, how much of it did you get when you got sick or bit, and how long did it take you to get diagnosed? So if you get on the proper treatment initially with whatever you have, it's more helpful to get better. Co-infections aren't all treated the same. So if you have Lyme and you got treated with doxycycline, let's just say, for example, but you have Babesia, Bartonella, or Ehrlichia, or something else, then they're all a little bit different. Now, some of them overlap, and doxy can kind of take care of some of them, but Bartonella is definitely different. Babesia is definitely different. Babesia is a parasite, not a spirochete, not a bacteria, so you have to treat them differently. If you don't get tested correctly, they can linger because you didn't do the right stuff to treat them because you never knew they were there. And then the immune system is still in that alarm phase because there's still something there. That's, I think, what they're asking why, right?
I think so.
You have to get tested right and then, of course, treated appropriately. Even if you do that, the alarms can still stay on in the cell danger signaling because of some other underlying things. And then we just keep working through that. So if you present and, individual patients, if they didn't get treated right, or excuse me, if they didn't get arguably tested correctly with all of the co-infections, then that's where we start to make sure that there's nothing in the background driving it. Mast cell reactivity tends to be something still in the background driving the immune response. But the question is what is it? Now, I have seen it with gluten. I've seen it with other food allergies. I've seen it with infections. I've seen it with post-traumatic stress disorder kind of thing, emotional states. And I've seen it turn on people that have higher levels of histamine genes, that they amplify that, but I've seen it turn off. It doesn't always mean that once you have those turned on, that it just lingers as a mast cell. Most of the time we can get those to calm down, but arguably it's a matter of getting tested appropriately of what you have. And if there's co-infections, you just got to treat them right.
Okay. Well, I was going to say we're down to our last question, but a bunch of questions have.
It's fine. I have whatever amount of time you want.
Okay. Well, we'll leave a little time for Eric to wrap up, but right now we still have some time. Can Lyme cause degeneration of bones?
Lyme causes oxidative stress. Oxidative stress just really beats up the body. It causes cell danger response, which turns on an adrenal response. Right here is the HP axis. But as your adrenals kick in and have a high stress response, cortisol is really high. Long-term cortisol is it's very big breakdown for the body. So yeah, but it's not just limited to bones.
Okay, somebody's asking, can you list the 10 items again? But I'm sorry, I don't know the reference of the 10 items unless you know what they're talking about.
Top 10 supplements. I'll just leave this up here for a little bit.
That would be it. Yep.
So there's 3. You're also having this play on the PA website, right? PA Lyme website.
That's correct. Yeah. So this presentation, if you want to go back and refer to it, it'll be on our Facebook page. It will be on our website, which links to our YouTube channel. So you've got a bunch of opportunities to see this presentation again. That's true.
And that's the one.
Right.
That's one of the mitochondrial supports that we have.
Okay, and this is currently the last question. Do you think applying organic castor oil to the abdomen at night without covering with a cloth pack and heating pad will still help with liver detox?
We have a lot of plain in community, Mennonite and Amish, and they a lot of times use conservative measures with that. I don't see that on a regular basis. Dr. Turnpaugh talks about how that does help. I have, certainly I shouldn't just say it's just that community, but other people that have done that, it does help. There was a question whether you have it covered or not. I don't have an answer for that, I don't think.
Okay.
That's a Dr. Turnpaugh question. I don't have a great answer for you because I don't see a lot of that in my patients.
Oh, and one final question. Does Lyme make us higher risk to COVID?
I thought I was going to get through this without that question.
That's a tough one.
Okay, so, and we talk about this a lot, but this has been our life for a long time, this slide. So when you hear COVID, you hear of a cytokine storm, right? I'll just talk to you, Bill. You've heard that, right? So I'm hopefully.
Yes, of course.
Yeah.
Yep.
So what does that mean? So, not everybody that gets exposed to COVID is getting COVID. Not everybody that gets COVID gets a symptom. Not everybody that gets a symptom gets extremely ill. So what's the difference? So then you go back to what I tell patients, you need 3 things for any illness. You need a compromised host, you need a bug, and you need more of an inoculum, a lot of a bug. So you need all three things. So, if you're a compromised individual, and that's certainly questionable, it doesn't mean if you have chronic Lyme that you're massively immune compromised. We have a ton of chronic Lyme patients that are really healthy because of all the work that we've done. But are you more susceptible to get COVID if you have Lyme? Not necessarily, if you've done the things that you can do to regulate your immune system, improve T cell regulation, which is vitamin D, glutathione, fish oils, quercetin, zinc, and resveratrol are the staples. And then anything that boosts Th1 are the things that we've all encouraged all of our patients to take as a preventative and then certainly as a treatment. Now that gets a little bit different. I'm not trying to clinically manage everybody, but cytokine downregulation is the key to not only COVID, but to our chronic Lyme, our autoimmune patients, our cancer patients, our patients with cancer, our mood disorder patients, our gut patients, all that. This has been our life for a long time. And it definitely sets the stage for patients that have had chronic COVID syndrome, which we're seeing. And is it just that you still have the bug, or do you still have your immune system thinking there's an alarm? You turn on the cell danger, doesn't matter what the bug is, you're turning on a cell danger response that's driving cytokines. So we're going to see more and more patients, I would think, with chronic COVID syndrome, and it's this pathway right here. And we've done this for years. Now, this is Dr. Turnpaw's slide. He's figured this out. Kudos to him. He's the one that's taught me, but this has been a staple, and it will continue to be for all of our patients to get better. This is our primary roadmap on helping you guys get better. Are you more susceptible if you get COVID, or if you have Lyme? Not necessarily, but you have to increase health this way. So it's health of host that we try and talk about all the time. Hope that was a great answer for that.
Well, thank you very much. I would say that's about perfect timing because that is our last question. So I'm going to turn it over to Eric to wrap us up.
Thanks, Bill, for your help.
Yeah, thank you, Bill. Dr. Smith, I'm going to ask just one other question, and it might be a little bit of a difficult one. I don't know if
I was just going to say it better be easy.
I don't know if it gets broached much to you or not, but from a support group leader perspective, it's really common for people to not have the financial wherewithal to get better. And the challenges of, first of all, finding a doctor they trust, getting diagnosed properly, getting a treatment protocol. But do you have any suggestions for folks that are challenged financially, if they have limited dollars, where they should go first as they start their journey to get better?
Well, a couple of things. One, that's why I try to put self-help stuff through this. And I know it's a big challenge, and it's a super big challenge for patients. And even our existing patients, I'm always trying to encourage them what they can do on their own and what they can do at home to help. Because it doesn't cost any money to go for a walk. It doesn't cost any money to get a hug, or to, do intermittent fasting and things like that. So that's number one. Number two would be, we do offer, I at least offer, we do a discount once a month. I know the clinic does it in general. We all kind of do that, but there's a financial hardship, call the office. And we kind of do like one a month discounted, or depending upon a financial status. We've helped patients a lot that way in our clinic. Elsewhere around the country, oh goodness. Go to your medical doctors and try. It's really challenging. We're trying our best to do educational series around the state. Dr. Turnpaw does around the country to educate docs on how to recognize Lyme and chronic Lyme, and then certainly the treatment component of that. Because a lot of times and I'm sure a lot of the people listening are well aware that they go to their providers and they just don't, they kind of get blown off sort of. But I would say start there to try to build a relationship. And if you've had a doctor that you've had for years, certainly they know who you are and as a person and as a family. Start there. You've got great relationships there, and just try to work forward. And if they're interested in learning more, I had a chiropractor that brought his patient in, and they sat in on my consult so they can help. We can teach at the same time. I'm very open to doing that. So we've had other medical providers come in that shadow us and things like that to learn for their patients. So we've done those things. As far as around the country, it's tough. I don't have a great answer for that.
Gotcha. That's very helpful. If you're looking for a Lyme literate medical doctor, looking for a practitioner that has experience in Lyme, again, you can go to palyme.org. We have a confidential network, a doctor referral based on the geography that you live. So we can point you in the direction of some qualified individuals. There are more medical professionals in Pennsylvania that are starting to become more experienced with Lyme. So that's very, very helpful.
And
I know-
also through ILADS, I forgot too. I mean, through ILADS, it's an organization
Yeah,
on a national standpoint.
we have challenges in northwestern PA, up in the Erie area, to find practitioners in that area are very challenging. And it's not unusual to travel. So, and oftentimes what we will say to patients is your first Lyme doctor may and probably will not be your last one. So it's a journey. It's not a once and done, and it is a continual improvement in getting new information and better information. So with that, Dr. Smith, always a knockout performance. Thank you very much.
Thank you.
This will be our last virtual Lyme impact session for 2020. And we're not going to hold one in December, so it's the month off. So Merry Christmas and Happy Holidays, and enjoy yourselves. It's a challenging time with COVID. It makes the family reunions difficult because of social distancing, but please do your best, and thank you for attending. Go to our website. This replay will be there probably in the next day or so. So thank you, everyone. Thanks again, Bill. Thanks, Dr. Smith.
Thanks,
Okay,
Eric.
thank you,
Thanks, Bill.
everybody.
Appreciate your time. Thanks for letting me come on.
Thank you, guys. Good night.
All right.